Welcome to your first lecture for the Nursing Professional Roles course. We're going to set the stage for this course and the future 2 courses that you will be taking prior to graduation. So we're going to start out with the introduction to the concept of professionalism. So you may ask, what does it mean to be professional? At SPC, we have chosen the following definition of professionalism by the American Nurses Association, meaning that professionalism in nursing means that we provide this high quality care to our patient. We uphold values of accountability, respect, and integrity. So when we look at that term professionalism, it also needs to be broken down further that to be identified as a profession means that nursing behaves in a manner that is expected and that all nurses have knowledge, skills, and attitudes to take care of patients, no matter where that patient resides. And as you go through school, whether it's in your skills class and you're being checked off, we look for knowledge, skills, and attitudes as you approach that skill. So let's take a look at an example that we might see. So safety is foundational in nursing. We have to have quality and safe practice. So if we were measuring what your knowledge, skills, and attitudes are, first we have to have the definition of safety, and we will have a module later on safety itself. So by definition, we're going to minimize risk of harm. We're always looking for ways that somebody doesn't fall, that they understand their medications. So you can see when it comes to safety that nurse has definitions of what that knowledge may be. How do we perform it? What are we going to do to reduce that risk? And what are our values or attitudes around that? Do we roll our eyes because we have to do it, or do we value that we really look at our patients, we see what their abilities are, and we implement things to make sure that they remain safe? The American Nurses Association also has a definition of nursing. So we have a definition of what it means to be a professional, but we also have to understand what the definition of nursing is. This is a long definition, but it really represents what we are. So that nursing integrates an art and a science of caring. And that is the beauty of nursing. We are an art and we are a science. And the art is the way that we show our relationships with others, that people feel caring. They know that we truly care about them. We're not just going through the motions. And later on, we're going to learn about the theories of caring and how those can guide us into practice. We focus on protecting promotion, optimizing the health and human functioning. We prevent illnesses where we can and injury, and that goes back to that safety. We facilitation of healing. We alleviate suffering through compassionate presence, and that again is the art. We have a science as well, and that's where we can diagnose and treat how people respond to us, whether it's a group, an individual, or community. So this is really a full definition of what nursing really is. So for any profession, but especially in the nursing profession, to be that professional nurse, you need to have criteria or meet these criteria. So that's specialized education. And as we'll see, there are many levels of nursing education, and you're starting out at entry level. We have our own body of knowledge. That's why we have associate degree programs to prepare you again for what knowledge you need to be that entry-level practitioner. We provide a specific service. We do have autonomy in decision-making and practice. We can make independent decisions about some of the things that we do that we don't need a doctor's order for. We have our own code of ethics, and we'll be exploring that in a future module. Professional organizations and publications. The American Nurses Association is a professional organization that I personally belong to. As a student, you can join the Student Nurses Association through in the hallway in the main building. When you're on there, they have a board and they'll provide information of how you can join. They'll probably even come see you in one of your classes. You can belong to the Florida Nurses Association. You can belong to different associations that you have a special interest in. Maybe it's critical care, maybe it's hospice and palliative care. And another huge thing about a criteria for nursing profession is we are always doing research. Nursing is always changing. It's not the way it was when I began, which is kind of excellent because we keep evolving. So I have a little video clip here to play you, and I think it really does a good job talking about what a professional nurse is.
Using Powtoon.
So I like how at the end she talks about needing that ability to keep moving nursing forward. And a lot of that does go back to the research. I really like this quote, and I think it's very important when we talk about knowledge, skills, and attitudes of everything that we do, that the character of the nurse is important as the knowledge that he, she possesses. You can do a skill and you can do the skill well, but that character that you bring, you'll often find questions like, why did you become a nurse? I asked you that to share with each other in this course as you get to know each other. That is where we're looking for, is that art. What is that characteristics that you bring to the table? Also at SPC, we have values of nursing that, again, that we show caring, that we have inclusivity, that we want everyone to come to the table. Everyone should feel a part, whether it's the education, and that you bring that into your practice. Another value or characteristic that we look for is ethical behavior. That'll be a topic we'll also be discovering in this class. We expect excellence, and we want to teach you and have you bring what we call a patient-centeredness to your care. Again, you'll be learning about that in this course as well. Nurses have many roles. We can be that care provider at the bedside. My primary role is an educator right now. I'm still able to do that care at the bedside, but my focus more has switched to education. We always advocate for our patients. You may be the role where you're the charge nurse or the manager of the unit or the dean of a college. You can take your role wherever you choose to be. You need to be a collaborator. We cannot practice independently. Leader, that is one where people want to follow you. That researcher, you may take that role where you want to move just nursing forward or education forward or find new improved ways that we can care for our patients with specific diseases at the bedside. It's limitless. So many roles to choose from. As you'll see when you're doing your readings for this module, we have nursing theorists that have come before us that guide how we practice. Personally, I like Watson. Watson is someone I really relate to. She has a theory of caring. You will also be learning about the theorist that helps us discover, and there's quite a few when it comes to how do we become competent to care for people with diversity and those of different cultures. You will find one that you identify with, and those principles or competencies will guide you along the way that you will bring into practice. Nightingale was our first. She's the one that brought it all together for us. As part of being a professional and having that education that we need or training, you can be an LPN, and this is where our licenses come in. And as you move through different educational levels, you will apply for different licensure because this allows you to expand your practice. So entry level might be at the LPN, and then there's the registered nurse. And under the registered nurse, you can start entry level from that associate level or BSN level. They take the same national exam, the NCLEX, for entry level practice. The differentiation is at a BSN level, you might have the opportunity to work in some different areas because you've had a little bit more education. You will see that many of our faculty are nurse practitioners where they can prescribe, treat independently. There's also what's called a DNP. Many of our faculty hold this degree. It's a doctorate of nursing practice. Some of the faculty have a PhD, which is a philosophy doctorate degree, and most of us that have the PhD have specialized in nursing education. For example, with my PhD, my research, my focus, everything has been to improve educational practices. That's where I enjoy, that's where my interest lies. Where a peer may specialize more and want to do clinical practice. So their DNP, their research is more from the clinical component. And together we move education forward and practice even farther. Once you graduate, you're going to find an area that you've just found your passion. It might be hospice and palliative care, and you can become a certified nurse in that. There are so many certifications. It can be for general med surgical, it can be for critical care. It's limitless. So once you find that, you want to celebrate your certification. It shows that you've gone over and above, taken more courses, chose to be that lifelong learner to say, I have expertise. I want to ensure that my patients get the best outcomes. One of the things with if you are coming back to school or even first time in school, your readings talk about Benner's ladder of clinical competence. And there are stages that we go through. And right now, you're at that novice level. You're just entering practice. It takes years to get to that expert level. Our goal is that you're very competent at entry level practice with your knowledge. Clinically, we will give you the tools you need to be ready to move up that ladder. And each of you will move across that ladder at your own pace. And throughout your nursing practice, you will come back to this ladder where you have a great foundation as a nurse, but maybe you're now moving to a new unit or changing positions completely in nursing to you've gone from bedside nursing to school nurse. You will have this transition where you have to go back and get new skill acquisition. So we talk about lifelong learning, but understanding this Benner's ladder of clinical competence really helps us appreciate where we're at in our own learning or skill acquisition. So this was an introduction to just what professionalism is, that professional nurse, introducing you to the American Nurses Association, and all of these will be talked about in much more depth throughout this first course. So we've given you the concept of professionalism and what it means to be a professional. But then we have what we call exemplars, individual items that fall under what makes us professional nurses. So in this course, you will have modules on what it means to obtain that license. How do we keep that license? How could we lose our license? The ethical principles that guide our nursing practice. We'll come back to the American Nurses Association and their code of ethics. You will learn about the Florida Nurse Practice Act, and there are practice acts for every state. So if you have this dream of becoming a travel nurse, you have to understand what a Nurse Practice Act is and how that may change from state to state. What will be your professional roles and responsibilities? What is HIPAA and confidentiality? So we have a lot to talk about and go through in this course. I'm excited that you're here.